Hello, everyone, and welcome to another episode of NPP Meet the Author. My name is Dr. Friederike Holze, and I'm part of the NPP Special Projects team. The NPP Meet the Author series focuses on highlighting early career scientists that recently published a paper in NPP. And today we're speaking with Dr. Anna Kirkland. Dr. Anna Kirkland is an assistant professor in the Addiction Science Division and part of the Youth Collaborative and Cannabinoid Research Collective at the Medical University of South Carolina. Dr. Kirkland specializes in developing neuroscience-based pharmacotherapies for adolescent substance use disorders using cutting-edge neuroimaging techniques. Her expertise spans nutritional neuroscience, magnetic resonance spectroscopy imaging, functional neuroimaging, and clinical trials. And today we are chatting with Dr. Kirkland about her recent paper published in NPP entitled The Neural and Psychophysiological Effects of Cannabidiol in Youth with Alcohol Use Disorder, a randomized controlled clinical trial. So your recent study is the first to test how CBD affects the brains and behaviors of young people with alcohol use disorder. Maybe you can tell us what made you want to explore these questions and why it is such an important issue right now.
Absolutely. Well, first of all, thank you so much for having me. This is wonderful. I'm very excited. We were really interested in this topic because the prevalence of substance use disorders really starts to peak during adolescence and young adulthood. So for alcohol use disorders specifically, we see about 3% of individuals meet the criteria for alcohol use disorder from ages 12 to 17, and then that jumps up to 15% by age 18 to 25. So that's really where these substance use disorders are starting to become really prevalent. And that can lead to lifelong issues in multiple different domains of life. So what our group is really interested in is finding a way to help those individuals early within their substance use trajectories so that they don't have to struggle for the rest of their life with something like an alcohol use disorder. And for cannabidiol or CBD specifically, I became interested in it kind of randomly. Well, there's kind of two sides to the story. One side, it's everywhere. CBD just had this huge boom after some of the policy and legal sides of hemp versus other cannabis products changed. And so you would see CBD all over the place. We always joke, like you walk down the street and there's a giant neon CBD sign on every store. So it's very prevalent. It's all over the place. People are really interested and curious about it. On the other side, I came in to MUSC as a postdoc, and someone had started to think about writing a paper about CBD and left. So then I kind of took the paper over and realized how interesting this compound is and how it could possibly have so many different uses, but with very, very, very little research to back it up right now. So that kind of grew into this project itself, where we want to be able to help people, but we also want to be able to provide them with something that can be accessible. So they should be able to get it pretty easily. It should be affordable. We want to make sure it has high tolerability and low side effects. And CBD kind of checks all of those boxes. Not to get into the regulatory issues behind CBD, but because that's a whole separate conversation. But it kind of was like, okay, well, there's some preclinical literature that's indicating it can affect alcohol use, seeking, and consumption, and maybe even craving or withdrawal. So there was a lot of preclinical literature indicating that it could be useful. And then some very, very early clinical literature pointing that it may be reducing alcohol use as well. So all of that kind of came together, and we decided that we wanted to try it out and see if we could find anything in this adolescent group with individuals who were non-treatment seeking but met criteria for an alcohol use disorder. So this study was funded by NIAAA, and it was an R21 study. So really just trying to start to see if there was anything worth pursuing more in the future.
Okay, thank you. It's super interesting. And interestingly, again, your study found that a single dose of CBD did not produce any measurable effects on brain activity, craving, or alcohol use. And were you surprised by that result, or what do you think it tells us?
Yeah, so um I don't think I was necessarily surprised. I wanted to be surprised in the opposite direction. I wanted something to happen, but I was very much prepared for us maybe not seeing a big effect. Um, the fact it was completely null, that did surprise me. I thought maybe something would kind of pop up or stand out. But one thing that I've really learned from going through this and writing this paper and seeing a lot of adult studies coming out right around the same time that used CBD in alcohol use disorder, that there are a lot of different reasons I think this might have happened. It could be because of their age and severity level. So they were pretty young. We're thinking, about 17 to 22 years old was our age range. And they were not treatment seeking, which means they may not be quite as severe as some other populations. However, they did meet criteria for alcohol use disorder. So they had some indication of potentially having functional or personal issues with alcohol, but it's hard to say how severe maybe that is in their everyday life. Another thing that was kind of different between our study and some other studies that came out was we use a 600 milligram dose, while a couple of other studies have used 800 milligrams. So it could be a dosing thing. However, we wanted to be on the safe side since it was adolescents, just to make sure that whatever we were giving them has been shown to be very, very safe and not have adverse effects in the literature. And luckily, our study, we had no adverse events related to the CBD dosing, which was really encouraging as well. Um, and so while we were really excited, we wanted to see something, I think there's a lot of reasons why this study may have come out to be null in so many different domains. Another thing, so for example, the psychophysiological part of it, so the olfactory task, we had them tell us what their favorite alcohol was, and we went and bought it, and then they would smell the alcohol or apple juice or water in a randomized order, and then we would see if they had any physiological changes like heart rate or skin conductance. And we realized when analyzing that data that the olfactory cue of their favorite alcohol did not change any physiological effects that we were measuring. So in that case, the task did not quite hold up to what we needed it to be. So that's also could be an underlying reason why that part came out null. Um, so we're still really interested in CBD. I don't think that this is a closed case by any means, but I think there's just some more digging that we need to do to conceptualize how to translate the way that adolescents use alcohol and how it could affect their lives into a laboratory setting. And that's kind of where my brain is right now is how can we make sure whatever we're doing in the lab is really capturing maybe what would make them crave alcohol. Is it social cues? Is it peer influence? Is it mood? Is it the environment itself? So those are kind of some different thoughts that I've had bopping around in my brain about this study.
That's super interesting. So, and with that, you already touched upon the last question I was mentioning to ask, which is, what's next, and could a different dose, a longer treatment period, or a different kind of cue make a difference in future studies? And maybe you want to just wrap up that again and.
Yeah, absolutely. I think all of those points are very interesting and valid. One thing that we recently came across was in a different study that we did with N-acetylcysteine. It was a long study, it was 8 weeks. And we found that only individuals who had moderate to severe alcohol use disorder had a reduction in alcohol use. So anyone that had mild alcohol use disorder, there was no effect. So we're thinking about changing the way that we structure our studies in order to really capture that more severe side of things, even early in age. We also think longer dosing could be critical. Also, another point that we would really like to think about in the future was inspired by Dr. Patrick Bach's study that they looked at CBD as well. And they found that that plasma levels of CBD were highly correlated with changes in all of their primary and secondary outcomes. So it could be a bioavailability issue as well. So I think there's still a lot of work to do within CBD, and that there's still a lot of potential. It's just finding kind of the right pathway to take next.
Amazing. Thank you so much for wrapping that up and for taking the time to speak with us today. And if you haven't already, please check out the article, which is linked in the video descriptions below. And as always, please feel free to comment to or reach out on social media if you have any questions.